Students have started joining, right? So just wait for a minute.
Number
there will be a bit slow, but that will not be visible to you.
335.
It will jump quickly. Here it is 347. You speak something so that I can listen to the sound of the music.
Okay. Good morning, students. Yeah. Speak something so that I can listen to the sound of the music. Good morning, students. Okay.
Now here you can see that this message of okay is complete. So now we are going to start it. The moment it will appear there, then you can start talking.
Okay, now to change the slide,
Now we have this.
only this. Otherwise, this also, है ना? Okay, better to use this one. This one, है ना?
You just wait for a minute. So now you can start.
Yes. Good morning, students. Hope you are doing well during this COVID time. And Dr. Gaurav Singh has been telling me that you are all participating in it very enthusiastically. And this particular session is Guidance and Counseling, which is one of the optional papers. Many of you may not have chosen this particular course. Even if you have not chosen it, if you have logged in, you can stay on. So we will now start the session. You can ask your questions or give your observations, and I will try to incorporate your questions and queries or observations as we move forward. Okay. So there are two activities you would be expected to do. One is related to guidance, the other one is related to counseling. Counseling is one of the guidance services. So we will first discuss the guidance services. I have mentioned here only a few. there are more. What you are expected to do, that you take any one guidance activity and then conduct it in the afternoon session. I have listed here a few. You may have already read the study material and you may be knowing what orientation service, what is class talk, what is group discussion, what is study tour, career talks, visit to career fair, etc. So you can choose any one of these activities and then do it in a group. How will you do it? It may be that some of you may be from the same school. Then you can form that as one group. Otherwise, another option is 2 or 3 schools, nearby schools. Then you can discuss, first of all, you should discuss what are the guidance activities in your school. If there is guidance activity at all, if there is no guidance activity, then do you think there is a need for starting guidance activity? So let me just briefly explain to you some of these activities. What is an orientation program? Orientation by and large, like when children come to school for the first time, you have to orient them. We can also call it an induction program. Sometimes children come from a nearby school and join your school, say in class 5 or in class 8 or in class 11. Then you have to orient those students about your school. What are the facilities in the school? What is expected of them? What all activities will be in the school? How they can engage in the school activities, and the library facilities, lab facilities, all these information you would give them. So orientation program or the orientation service, what you give is basically giving them information. So if we look at the class talks क्या है? A teacher can give a class talk. You have to choose a topic. The topic you will choose according to the level of the students. Say for example, elementary level students, secondary level students, or higher secondary level students. I'll give you one example of a class talk that you can do. Time management. So you will prepare that topic and then give a class talk to the student. So in time management, what you have to think about is what all points you have to cover. Now can you think of some points? What should come under the topic time management? Suppose you are talking to your class 9 and 10 students or class 11 and 12 students. So what topics should or what points should come under the topic time management? One would be obviously about study time. Another would be about their playtime or watching television or spending time with the family or spending time with the friends. Many times we find students are unable to manage their time. They may concentrate on only one activity. Either they would engage all the time in studies or they would spend time with their friends or they would be into sports activities that is not going to help them. So one has to manage time. So you should choose topics accordingly to give class talks. Another topic could be study habits, how to develop good study habits. And a third topic can be, suppose you think some of your students are entering into or getting into some kind of activity which is not going to be good for them. Say, for example, smoking or taking drugs. Then also you can organize a class talk. And some of these topics again you can bring into group discussion. For example, drug abuse or a substance abuse. You can organize a group discussion in a classroom and ask children to discuss about the perils of using drugs or abusing drugs. Because that is going to help them to understand how to lead a healthy life. You may be already doing study tours or study visits for the students. So sometimes you may take them to visit a museum, sometimes some science exhibition, sometimes maybe historical monuments, or maybe if you are near the capital, you might take them to observe the assembly session. So how do you organize this? What are the things you have to do to conduct a study tour or a study visit? What things you should do? First of all, you have to organize it. You have to contact the person in charge of that particular place. Then arrange the visit. Then take the children safely to the place and back. So therefore you may need to arrange a transport. And then someone should be there to explain things to them. And once this activity is done, what is expected by the students? So you have to orient them to prepare a report about what they have observed, what they have learned. So you have to organize a study tour in this fashion. Another guidance activity that you can do is career talks. What is career talks and what stage this career talks is mostly needed? You are well aware that class 10 is a terminal point for many students. Then the next stage is class 12. That is also a terminal point for many students. So when students enter into class 9 and 10, that's the right time to give them career talks. So again, you have to organize these career talks. So how will you organize career talks? One way is that you can do it yourself. But then you have to ask yourself whether you have very good idea about all kinds of a career. If you don't have, then what should you do? You should consult literature and then collect data about different career possibilities. And then what the students are expected to do. Another way of organizing career talks is you can call people from outside the school. Meaning, for example, you can call a doctor and request the doctor to speak to the students. You can call a lawyer, you can call engineer. So, and you can also ask students what are their expectations. You can call defense personnel. You can organize it yourself and also in discussion with your students. Career Talks activity is very good at the secondary terminal stage as well as the higher secondary terminal stage. Career Talks, we can extend it to take them to a career fair. Sometimes even international agency also come to our country, showcasing the opportunities they have in their countries. So you can take students to such a career fair. Sometimes it is also called as a education fair because after 10th and 12th, one doesn't start a career immediately. Therefore, it is basically what stream of academic path they would take or what education stream they would take. So the career fair sometimes is known as education fair. One example I would tell you, like when IGNOU organizes IGNOU's convocation at our regional centers as well as here at the headquarters, we put up exhibition. So we showcase the different programs we offer. So students come to our education exhibition. So then we explain to them what each program mean. So then accordingly they can select their future academic program. So you can take your students to career fair. So these are some of the activities that you can do in the school. There are more activities I have given in the study material. You can go through it. Presently what you have to do is select any one of the guidance activities and then you write a report how you will organize it. You have to do it in a group. As I said earlier, you can form the group if say 3 or 4 of you are from the same school. Then you can discuss what are the activities already available in your school and what guidance activities are to be given more. Then you come up with a report. That is how you would do it. All right? And if you have any question or query, like you can share it in the comment box. So far, I have not seen anything. So I would now proceed with the next topic of our discussion. As I told you earlier, counseling service is one of the guidance services. Your second activity in the workshop is to be done that is related to counseling. So we will presently discuss some of the counseling skills. Then we will discuss the activity you are expected to do. Here we are going to discuss some of the counseling skills. One of the counseling skills is active listening. Now what is active listening? which means counselor not only listens to the words spoken, but you also notice the feelings, the facial expression, emotion, gestures, and the thoughts of the client. So you have to develop that kind of a skill. That's why we call it a active listening. It is just not the words spoken. How the words are spoken and the feelings coming on the or the facial expressions, the feelings the client conveys. So an effective counselor should notice all these. That is when it becomes active listening. And I think as a teacher, we have to be always active listeners in our classroom, even when we are teaching, not directly involved in counseling activity. Because when we are teaching a point, we should know whether our students have understood it or not. So we can see it from their facial expression, the gestures, and we should also be able to read the thoughts, that unspoken thoughts of the students or the client in a counseling situation. Now, another important skill is attending. Attending skill and listening skill, they go together. When you're listening, you're also attending. So active listening is possible only when you are giving your total attention to the client. Which means sometimes you see people doing, you're speaking to them, but they are engaged in some other activity, maybe speaking on the phone or writing something on a pad. But if you say that I am speaking to you, they would say, okay, you speak. I am listening. I can hear you. But that's not the way. That is not attending. That's only hearing. So as a good counselor, or to be an effective counselor, you should develop attending skill. You are listening as well as attending. So these two skills go together. What happens if you are not attending? Then the client gets the feeling that you are ignoring the client. You are not taking the client seriously. Even you just you think in your personal life also. Many times your children may be complaining, you are not paying attention to me. Or as parents, when you are saying something to your children, if they want to avoid you, they would not attend. Then you also complain. You are not paying attention to me. So I hope you understand what these listening as well as attending skills mean. To be an effective counselor, you have to have both active listening and attending skills. Now let's see another aspect of this attending skill. Again, comes out with a few aspects of the attending behavior. According to Egan, you have to face the client squarely, meaning the client should get the feeling that you are accepting the client. Then you should have an open posture, which means again, like you're facing the client and you are very open to whatever the client is saying. It's not that you turn your chair to aside and looking out of the window. So that gives the client an idea like you're not welcome and you're not attending, you're not paying attention. Also like leaning a little towards a client. But please remember, you should not be leaning too close to the client. Then the client may also feel that, you are entering into the client's private space. So you have to be very, very careful about that. At the same time, suppose you sit away from the client, then the client thinks you are not interested in the client. So therefore, again says, leaning a little towards the client gives the client an idea of that you are interested in the problem of the client and you are there to help the client to solve the problem. And then eye contact with the client. It should not be that as a counselor, you should be looking everywhere except at the client. So for a good counselor, eye contact with the client is necessary. It's not that the counselor should be looking at the roof, looking at the wall, looking at the pen, or things like that. So an effective counselor should have eye contact with the client. Then another aspect which again discusses is relaxed state of the counselor, which means the counselor himself or herself should not look very tensed. The counselor should be in a very relaxed state of mind. So that gives the client a very positive vibe. If the counselor herself is very worried or looking in a tensed situation, then the client would get the idea like either the counselor is not able to help me or the counselor doesn't want to help me. Meaning, if the client reads indifference, then the client finds it difficult to open up with the counselor. You can write comments. If you have any observations, please do write in the comment box and I will try to cater to your comment or your questions. Now, paraphrasing is a skill which all counselors must develop. What is paraphrasing? That is restating or rewording the content set by the client back to the client. Meaning the client comes to you with a problem. So you would ask the client to describe the problem. Since the client is in a very disturbed state or confused state of mind, the client would say so many things. So, as a counselor, therefore, you would either restate or reword the content set by the client back to the client. And why do you do so? That is to confirm with the client whether you have understood, meaning the counselor has understood the problem narrated by the client. So, paraphrasing therefore involves reflection of the content and the feelings of the client. You remember earlier we discussed the two skills, listening as well as attending skills. In listening skill we said it's not only the words the counselor would listen to, it's also the feelings, emotion, etc. So paraphrasing therefore involves the reflection of what the counselor has listened as in words as well as seen as in feelings and emotions of the client. Then asking the client to confirm what you have said is the one that the client has meant or the client has narrated. Because unless the problem narrated by the client is understood by the counselor in its proper way, the counselor may not be in a state to help the client to find a solution. So therefore, paraphrasing skill is very, very important for a counselor. Now we are moving on to another very important skill, that is empathy. Showing empathy to the client. What is empathy? Empathy refers to the counselor's ability to sense what the client is feeling, experiencing, and thinking. So to have empathy, first you should have an active listening skill. When you have active listening skill, you observe the client's feeling and also what the client is experiencing and thinking. So then you develop empathy when you understand the feelings, the experience, what the client is going through. That is what is empathy. Otherwise, what we say is, usually like, in commonly or usually we say, the bearer of the shoe knows where it pinches. So therefore, you have to put yourself in the other person's shoe to understand their feeling. That is what is empathy. Okay, we'll now move on to asking questions. That is a very important skill again, because unless the counselor asks questions, the counselor may not be able to fully understand the problem faced by the client. So asking questions is a way to find information or collect data and engaging with the client. What is fact finding? Fact finding is information that is like related to the age, occupation, family, education, friends, because that will give the counselor an idea about the social settings from where the client is coming. Then the counselor asks questions to engage with the client. Obviously, the counselor will ask the client to explain the problem or describe the problem. The client may do so, but the client may not be able to describe it in a totality. So therefore, the counselor will ask probing questions. That is open-ended questions. Your questions should not be, you should avoid like, yes or no questions. So to understand a problem, you should frame the question in such a way that it should be open-ended. Then only you can elicit a response from the client, so that you can probe further and expand a response. Explore deeper into the client's problem. So therefore, asking questions is important to collect data related to the problem which the client is facing. This is a skill that refers to the counselor disclosing feelings about the client as the client is describing a problem. The counselor may disclose a feeling. Let me just give you an example of immediacy. If a student has come to you with a problem, which is the student has suffered sexual abuse. So the student is describing her or his experience. The counselor then may disclose the counselor's feeling. You remember this, the skill of immediacy is, it refers to the counselor disclosing feelings about the client. It is not the client's feeling. So as this client is describing the sexual abuse experience, say, if the counselor says, I appreciate that you have trusted me with this most traumatic experience of your life. So that is the skill of immediacy, because the counselor is disclosing counselor's own feelings about the client. Now we'll discuss a skill of self-disclosure, then we'll again come back to immediacy, because the skill of immediacy and the skill of self-disclosure are very close. So let's see what the skill of self-disclosure. As the word suggests, self-disclosure, which again refers to the counselor stating feelings about a similar situation as the client is presently in. Let me give you one example for that. A student in your school, suppose you are the counselor, the student has approached you because the student is fearful of or afraid of public speaking. The student is, even within the classroom, the student is unable to say any answer when the teacher asks a question. The student knows the answer, but so fearful of speaking in the class. So that is a problem. Public speaking. Afraid of public speaking. So the student has approached the counselor. So the student is describing the problem. And if the counselor says, I can empathize with you, I had a similar problem when I was in elementary school. So that means the counselor is disclosing something about the counselor. So that is a skill of self-disclosure. Now you would see that the skill of immediacy and the skill of self-disclosure are very close. Because in both the places, the counselor is expressing the counselor's feeling. In immediacy, the counselor is feeling about the client. In self-disclosure, the counselor is disclosing something about the counselor himself or herself. But we have to be very, very careful. Both these skills we should use very, very in a limited way, especially self-disclosure. Why? Because the purpose of counseling is not to talk about the counselor. And when the counselor starts talking about himself or herself, the client may get the idea that it is okay to have such a problem, that the client doesn't need to modify the behavior. So that is not the purpose. And the client also may therefore think one doesn't need to further then work on this problem. So therefore, self-disclosure intervention should be very concise and used very conservatively, meaning in a very, very limited way. It is not necessary to use the skill of immediacy or the skill of self-disclosure too often in counseling sessions. As I said, it should not lead to self-indulgence of the counselor. So, counselor should not have that tendency to talk about himself or herself. That will harm the client, because the client may think the behavior is okay, or it is now time to terminate this counseling service. There is no need to work on it. So that is a skill of self-disclosure. Now summarizing. Summarizing like paraphrasing. Towards the end of the session, or if it is a 1 hour session of a counseling, maybe after 15 minutes or half an hour, the counselor may summarize the content presented by the client after listening to a series of statements, or it can be at the end of the session also. So paraphrasing and summarizing therefore a little different. Paraphrasing is often enough done, but summarizing is not often enough. It may be twice or maybe at the end of the session after a series of statements are given by the client. But this is a very important skill, because once it is summarized, then the next stage would be like goal setting. The problem was described, presented by the client. Then, now the counselor has summarized it, so they will now move on to goal setting. What is goal setting? It is not that the counselor would only listen. Then the counselor will help the client to set goals, to modify the behavior, or to develop a new behavior. So after assessing the problem, the counselor works with the client to set realistic goals or behavioral changes the client wants to achieve. What does it mean, realistic goals? For example, if a student comes to you that the student's academic performance is not very good, so the student wants to improve. The student is very hardworking. However, the result is not shown in the academic at the end of a term and examination or whatever it is. So if a student approach you with this, what could be realistic goals? If the student has been just about receiving 40%, would you set the goal as next time 90%? No, that would not be very realistic. So step by step you should take, so that the client also can achieve it and then get that feeling, yes, this is an achievable goal. So that's why you should help the client to set realistic goals. It's not that after 2 days or 3 days you can completely modify your behavior or acquire a new behavior. So therefore, the counselor has to be very careful in setting the goals. Remember, the counselor will not set the goals. The counselor only help the client to set realistic goals, because it is the client who has to work on the problem of the client. It's not the counselor. The counselor is there to only help. So therefore, goal setting is a very important skill. Now, counseling service is done in different sessions. It's not that in one session counseling is over. So in the first session, therefore, another thing what the counselor does is set boundaries, which means after listening to the problems of the client, after summarizing it, the counselor helps the client to set goals. Then they also decide at that time, okay, we will sit for 5 sessions or 6 sessions or 10 sessions. So that is again an achievable goal. So that is one thing they'll do. And then the counselor is supposed to set another boundary. Each session, at what time it will begin, at what time it will end. Say if each session is of 30 minutes, then it's only 30 minutes. And if it starts at 12:30, it starts at 12:30. Then it is 12:30 to 1 p.m. Not beyond that. So set the rules of the counseling contract, because counseling is a contract. Being late means foregoing the session, meaning the counselor has to make it very clear to the client. You cannot be late for the session. If you are late, that session is gone. Then working towards a set goal is the responsibility of the client. It's not the responsibility of the counselor. Then follow up by inquiring at the beginning of the next session about the client's accomplishment in the world outside. Remember, in this particular session, if a goal is set, when the client comes for the next session, the counselor must follow it up by inquiring, okay, so tell about what you have accomplished in the gap. Say there was a 1 week gap or 2 weeks gap between sessions. So the client had agreed on a contract that the client will work on the goals. So when the client comes for the next session, the counselor must follow it up by inquiring what the client has accomplished. That is important. So that is why ending the session and following up the session are both important skills. Then termination of counseling is also a skill. See, counseling is a contract. Therefore, it has to end one day. It cannot go on forever. When does a counseling session or counseling service end or terminate? Termination usually happens, suppose the client has accomplished the goal. Then that is why in the beginning itself you said the number of sessions, 5 sessions, 7 sessions or 10 sessions. According to the problem, the counselor will have to assess the problem and then decide how many sessions they need to sit together. In some cases, the client may accomplish the goal before the stated 10 sessions. So then the counseling can be terminated. So that is then decided by the counselor and the client together. If the client has accomplished the goal, then the counseling service is terminated. Or even before accomplishing the goal, after 2 or 3 sessions, if the client feels the client wants to end the relationship, then also the counseling service is terminated. You cannot otherwise hold the client, no, 10 sessions we had decided upon, therefore you have to come, because you cannot force a client. Or the counselor wants to move on. Sometimes the counselor feels in this particular counseling relationship, things are not going in the right way. So therefore, the counselor probably wants to terminate. So in such a case, like in any of this termination, therefore the counselor should prepare herself and the client for the termination. Termination should not be abrupt. Why? If termination is abrupt, the client may feel that the client is abandoned. So then whatever the goal that was accomplished, it may diminish. There is a chance. So therefore, the termination has to be discussed between the client and the counselor, and it should be a smooth process. It should not be abrupt. So the client should not feel that the client is abandoned. So this is a very important skill, therefore, how you terminate the counseling service. So now we have discussed many counseling skills. Now you have to use these skills when you are providing counseling to your students. So therefore you have to practice it. Now there are different counseling techniques used for giving counseling. So we will take one of those techniques and I will explain it. Then you can take that as an activity in your afternoon sessions. So we'll discuss only one particular technique here. There are many techniques. Behavioral techniques are there, meaning behavioral interventions, cognitive interventions. There are many techniques under each of these interventions, and you can also use transactional analysis as a tool in counseling process. But today we will look at role play, which is a behavioral intervention. So let us see what is role play technique. So as the very word suggests, like, you have to engage in a play, meaning you will assume a role and the client will also assume a role. Then you play it out. Let me give you an example. Many times it happens. Children have a certain idea about their future, what they want to pursue as a career, and parents may have a different idea about what they should pursue as a career. As an example, parents who have a legal firm, both parents are lawyers, they have a very flourishing legal firm. So they want their son, only son, to join them in the legal firm, which means they want their son to take legal studies and pursue a legal career. Whereas the son has inclination towards art, meaning he does very good drawings and painting, so he wants to pursue fine arts. So there is a problem. The child doesn't want the parents to be unhappy, but at the same time he cannot make his point to the parents because he finds the parents very intimidating. So therefore he approaches the counselor. So here the counselor and the client assume specified roles and enact a problem situation. The problem situation I explained to you. So in the first session in the role play, therefore the counselor would play the role of the client, meaning here the student's role. Then the client does the role of the other actor, which means the parent. So in the first role play, therefore the client observes how the counselor is acting the role, his original role. Then in the next session, they reverse the roles. The counselor takes the role of the parent and the student is in his own role. And the student is then trying to model it on in the last session what the counselor was doing. So this is then repeated. After each session, then they discuss how the client, or in this case a student, is able to modify his behavior. So for your activity, you have to take up this role play activity. So in that, there will be two of you. First of all, you would discuss a problem situation. Then one will become the counselor and the other will be the client. Then you have to do both the roles. So that is how this activity you will play out. So this is a role play. Now I understand our time is up. I had not seen any question from you. Therefore, I did not. I could not interact with you. I hope you have understood what is so far discussed. Okay, so this is your second activity. First activity, you remember the guidance activity. The second activity related to counseling, and you will do the role play. So you will change your acting role. So which means at least twice you have to do and then discuss, and then you will come out with a report what you have learned from that. So we will now wind up. So wish you all the very best, and I hope you continue to enjoy the workshop and stay safe during the COVID time. Thank you. हो गया ना? कंट्रोल की होगा ना? हाँ